Shatina Williams. I am the Executive Director for the Center for Wellbeing Programs and Psychological Services. I am going to share a few things with you today. I'm going to give you an overview of our wellness options. Our office is one of a few or many, depending on how you look at it, spaces in which students can really focus on their wellness. And we're truly dedicated to the well being of our students from a holistic mental health, physical health lens. I'm going to discuss some of the benefits of wellness for college students. And then I'm going to explore top program events hosted by our Center for Wellbeing. So, to get us started, a wonderful way to look at our center is two arms. We have the psychological services side, and then we have the well-being programs side. So, on the psychological services side, this is psychotherapy. So, at American University, we have free individual and group psychotherapy services. Now, anything that's free can come with some limitations because, why pay for therapy when you can get it for free? So we offer 6 to 8 sessions per school year for our students. For many students, 6 to 8 sessions, it's perfect. It's what they need to adjust to school, to get through a challenging situation, to figure out some things about themselves, talk through some difficult things, and it's perfect. For a number of our students, it's not quite enough. And so group therapy is also a wonderful option, which is free and available so long as there is still space in the group and depending on when you're joining in the semester. So if you're trying to join a group in December, people are about to leave for break. So maybe we'll start you in January. We also have a robust referral system. So the student health insurance is Aetna. Um, Now, I will make a note about the student health insurance or insurance in general. A lot of students come into the university with wonderful insurance. And maybe they've been meeting with a provider that and they have excellent benefits. I would encourage you and your families and loved ones to consider how relevant your insurance is in the Washington, D.C. area. So, for example, if you have Harvard Pilgrimage Insurance, that is a wonderful insurance in the Boston, Massachusetts area. However, in the District of Columbia, if you're looking for a therapist in the District of Columbia, that can be very challenging. So, you may want to consider what your insurance options look like here. And sometimes we can anticipate the needs that we would have. For example, say you've been in therapy since 8th grade and working through anxiety. Maybe now is not the time to test out whether or not therapy is still going to be helpful to you. You may want to continue on with your same provider at home if they're able to provide those services, or switch your provider to the Washington, D.C. area. And so considering the insurance that you have. We offer a number of group therapy options. We offer those for interpersonal relationships, for anxiety and depression, some specific for certain student groups, for example, students of color. Um, and then, of course, our time limited individual therapy. All our services can be virtual or it can be in person. Just depends on your preference. So long as you're in the District of Columbia, we can do teletherapy services with you. And incoming students can set up an appointment the week before orientation week and can start meeting with our providers starting orientation week. I will say that the student has to make the appointment themselves. No one can make the appointment. So if you have a previous therapist, they can't make the appointment for you. Parents and caregivers cannot make the appointment for you. You have to make the appointment yourself. What we also offer is 24/7 crisis support. And so, say, for example, you're having a really tough moment at 3 o'clock in the morning and our center is closed, there is a wonderful phone number that you can call and talk to a licensed clinician about what's going on and get the care you received. Now, we don't define what a crisis is for you. It can be something that you're having a difficult moment, or you can be in a really urgent situation where you're like, I really need to figure out what to do right now. And that phone number will appear on a different screen. Our survivor advocacy services. This is one of the hard ones. We hope that our students have a wonderful, safe, caring experience with their community, with those outside of the community. But unfortunately, sometimes there is harm. And so we have victim services advocates that our students can speak with if they've been harmed by another person. This could be stalking, it could be a violent attack of some sort. Unfortunately, it does happen occasionally. And so there are supports available for students who experience that. On a similar vein, unfortunately, alcohol and other drugs can also be a concern. We are in the District of Columbia where something like marijuana is abundant. And if you check out our website, we have some wonderful resources on safe use of alcohol consumption, of good sleep hygiene, lots of psychoeducation services. But say, for example, you're concerned about your drinking or drug use, we have a dedicated consultant that you can speak with and get some education, asking yourself, I drink a lot on Friday, but I don't drink on Saturday. Should I be getting help for this? And they'll talk you through some strategies and thinking through what safe use looks like for you. Also, sexual health programming. So our university does offer free contraceptive services. So anyone can stop by our office and pick up some items that they might need um, to engage safely. We also offer a peer health educator program. Now, these are students like yourselves who go out into the community and educate the community on a variety of topics, from mental health to sleep hygiene. So, if you're having a program at 9 p.m. in your residence hall on something related to health or mental health, it's likely one of our peer health educators. And it's a wonderful program for students who are interested in public health. And of course, psychoeducation programs. So, for example, say you are wondering how do you support a friend in a crisis, we offer something that we call a QPR, question, persuade, refer, that can really assist you in how to support the people in your circles. Um, as a reminder, all of our services are free and confidential, and we'll talk to you about what those limits of confidentiality are when we are meeting with a student. One of the hard things that a lot of students and families and caregivers can struggle with when a student comes to college is that access to their medical records, access to their doctors, it's very limited. So I cannot speak to anyone on behalf of another student without explicit and written confirmation from that student. So even if your student says, I've been talking to a counselor at American University, and you call our center and say, I know my student is being seen there, I kind of want to get some information, I will say, unless there's release of information on file, I can neither confirm nor deny that I know who your student is. It can be a very difficult transition for families, but very necessary for our students to feel like they have someone to talk to. And it's not always for bad reasons. Sometimes our students don't want to worry their parents or caregivers. Sometimes they want to have a place to talk about issues that um, they would feel embarrassed talking about. And so having this confidential space can be very important for them. In terms of making an appointment, you can always contact our front desk and the numbers here below, as well as the 24/7 crisis support, once again, free and confidential. For our survivor advocates, you can book online. And if you have not visited our website is pretty user friendly, and so all the information will be right there. So why are well-being services important? College can be wonderful. You will have wonderful experiences. You will have meaningful relationships. You will learn. You will engage with others in different ways. And it's important that at this point, when you're trying to figure out how do you do it in a way that makes sense for you, that you have support in navigating that. Maybe at home you had a curfew. Maybe at home you had a bedtime. And now you're trying to figure out, well, my everyone is staying awake until 5 o'clock in the morning and I have a 9 a.m. class. I'm trying to figure out how to navigate these different things. It's a wonderful opportunity to figure out what makes sense for you and to start developing some practices that can carry you long term. And prevention programming is important. Of course, we're here for when the hard stuff hits, but we're also here to support you before the hard stuff hits. So, like I say, you don't have to have anything wrong with you to talk to a health educator, to talk to a therapist. Maybe you just have curiosities and questions, and we are here to support you in those curiosities and questions. All right, why are well-being services important? Why do we exist? Um, College is a time in which a lot of our students will experience mental health concerns for the very first time and will struggle to navigate, how do I deal with this thing that is so different for me? So depression and anxiety, unfortunately, it hits. And sometimes we have anxious moments, we have anxious seasons. And if it's at the point where it is stopping you from being able to engage meaningfully with others, stopping you from engaging with your schoolwork, if it's impacting your sleeping and eating, and you finding your patterns changing, maybe that's a sign that you might need a little bit of support, or maybe even a lot of support. I tend to give this example. So if you are willing and able to do it with me, please do it with me. So I'm going to ask you to clasp your hands like I've just clasped my hands. And I want you to notice how it feels. You just clasped it naturally. For me, my right thumb is over my left thumb and I'm interlaced. And so just feel how that feels for you. Now I want you to switch. So if your right thumb was over your left, now your left will be over your right and vice versa. Now see how that feels for you. Now, I can't see 98% of you. Um, and even if I were to see you and I saw your hands clasped, and you can unclasp your hands, I would not be able to tell from the outside looking in that that second position was uncomfortable for you. Only you know that for yourself. And so it's important that you recognize what doesn't feel quite right to you. And if you start to feel not quite right, that it's okay to ask questions and seek support. That's what these resources are here for you. Some mental health concerns that are on the rise. One is social anxiety. A lot of people will have questions about how are they being received by others? How are people thinking about them, experiencing them, and will become self-conscious in that process. Being in a new and different environment can increase that anxiety. It sounds so great. I'm going to college. I am meeting people in my residence hall. It's going to be great. And then you get there and there's all these people who are so different, doing different things, having different musical tastes, different styles of dress. And you may find yourself being a little self-conscious. And that's okay. It's at the point where it starts to impact your functioning, where maybe you want to get a little bit of support. Also, and we never want to minimize this, which is the thoughts of harming or killing yourself. So suicidal ideation. Now, this is the end of the spectrum where we never want a student to get to. And if you do get there, it's okay. We will support you in navigating that. And if you have a friend who is saying things that are concerning, it's okay. We can help you navigate that with your friend. And you can also encourage your friend to come and seek support themselves. 1 in 5 people will experience a clinically relevant problem before the age of 25. So 20% of our students at some point will experience something that is really negatively impacting them. And this is not, I'm anxious in this moment. This is that I'm really anxious. I'm really depressed. Something is wrong that I can't quite figure out in a way that's impacting you. And we want to prevent you from getting to that point. And then there's some of the fun stuff. We do wellness programming. So about twice a year, we bring therapy dogs to campus. Some of you will miss your cats, your dogs, your furry friends, and your pets, as they're likely to stay home and you're at school. So we bring them to campus for you to love on them and for them to love on you for a little while. So definitely follow us on Instagram um, to engage with that. Fresh Check Day is a mental health fair where we talk about all things mental health. So if you're like, what is even mental health? We're here to talk to you about that. We do crisis intervention training across campus. So how do we work with students who are experiencing a difficult moment and not necessarily running to something is let me give you an example. Say, for example, someone is in their residence hall. They haven't come out. They're playing their music really, really loud. They've been acting pretty erratic. Our first assumption is not going to be that that student is being a disruptor to the community. our first question is going to be what's going on for that student. And so we take a step back and we're asking ourselves what's going on with the student that is causing them to behave in a way that I would not expect them to behave. And we try to have some conversations about that. I mentioned QPR, question, persuade, refer, about how to support someone who is going through a hard time. And of course, mocktail events. How do we engage in safe alcohol use? Here is where we are located, how you contact us, our website with plethora of information. I have a wonderful team. I call it a small army of licensed therapists, of advocates, of consultants, and educators who are here to support students. They come from all over. They all practice a little differently. So even if you're meeting one person, it will be very different from meeting with another person. And that just means that we have a diversity of individuals to engage with. And that can be wonderful. This is a time where now I can open up questions for any of you that you may have for me. I think you can add them in the chat, or you can unmute yourself and ask those questions. All right, so there is one. Okay, yes. Do the 6 to 8 sessions include group therapy, or is group therapy in addition to the 6 to 8 sessions? So 6 to 8 free sessions is separate from group therapy. Group therapy is unlimited, 6 to 8 sessions of individual therapy per school year. And we go by kind of the academic calendar, so it resets every May. And then single sessions. So single session appointments, and thank you for bringing this up. Single session appointments are when maybe you have a very unique concern. Maybe you had a breakup and you're like, how do I deal with this breakup? Maybe you had a loss somewhere in your relationship network and you just want to talk to someone, or maybe you're concerned about a friend. So you can get a free single session appointment where you're really focused on just talking to a therapist about something. I'm going to, Josh, did you drop your question in the chat, or if you want to unmute yourself, happy to answer that question that you have.
Yeah. My question was, I was wondering, so I have a therapist where I'm at locally, and he says he can see me on Zoom down in DC. Is there like how would I go about like finding a good private place for doing that? Do you guys have any good recommendations on campus? Just because like I'm thinking I have a roommate and all that, so that's not the best place.
Yeah, that's always a difficult question. We don't have it in our center. We do offer one space on campus through our center. That's more like a decompression relaxation space, but the hard part about that one space, that there's no reservation system, that students can drop in and use that space if they want a private location. There are a few private locations on campus. We would have to get that information for you, but unfortunately, there's not a lot. And it's really good that you can continue meeting with your provider at home. Often encourage students to talk to their roommate about, like, hey, you don't even have to get specific. Hey, can I have the room for an hour on Tuesdays at 2 p.m.? And there's a lot of bartering that takes place between roommates. Can I have the space on Thursday at 3? Can we work something out like that? So that's a really good question. Do we have an Active Minds chapter or something like Active Minds? I think the closest would be the Peer Health Educator Program. The Active Minds Akin is a student organization, and I can't quite remember the name of it. I'm not even quite sure, but if you look through the Engage app and you can see the student organizations, you can probably find something akin to Active Minds. The pharmacy, so Walgreens is right down the street from the school on New Mexico Avenue. It's literally maybe like a 4-minute walk from campus. And also in Tinleytown, you can take the shuttle to the local CVS. I will say, if you're thinking about if you're currently taking medications for a mental health concern, our office doesn't manage medications. However, the Student Health Center does. And they have 2 psychiatric practitioners that are absolutely wonderful. I would say definitely talk with them, especially if you're on a type of medication that has a lot of regulations around it. So, for example, stimulants have a lot of regulations around them. And so you want to make sure that you're following up with them to figure out how do you do that cross-jurisdictionally. Perfect question. So yes, we can take over monitoring of psychiatry. There will be some limitations, just like with any provider, there may be some limitations where they may refer a student to a higher level of care, but for the most part, they're happy to do that. I would say set up those appointments sooner rather than later, because at some point in the semester, the appointments get pushed out. And so, if you have 1 week left on your depression medication and the next appointment isn't available for another 4 weeks, you're kind of in a bind there. So you want to make sure you're setting up those appointments early. Another question is, if my child has an ongoing diagnosis but will likely continue with the home therapist, would your office want to have information about their diagnosis or treatment? Not necessarily. Um, we don't hold files for students in which are not directly in our care. Now, there may be people within their network that you may want to alert to their mental health concerns, maybe look out for signs or offer them some additional support. So identifying what those people will be. Maybe it's an RA, maybe it's a roommate, maybe it's someone in their circle. How hard is it for students to make an appointment, and do students have to wait long? Not at all. So from the moment a student calls for an appointment, and the moment that they attend their appointment, the average is about 3 business days. 20% of our students get an appointment the next day. So it's not hard to get an appointment. There is a crunch time around November where I say it's like 12 p.m. at the club. No one can come in until someone comes out, although we're able to navigate that. Fortunately, in the last 2-3 years, we have not had a waiting list. And so we're crossing our fingers that that remains the same. If, as a parent, you suspect something may be off, is there someone we can contact? Absolutely. We are here to consult with you and talk through concerns with you. If you want to alert the Dean of Students office that you're concerned about your student, especially if it starts to impact their ability to be in the residence hall or be in class, and figure out those options for you. It may be, maybe I do need the tuition insurance because I'm not sure, based on my students' past history, if they might be able to make it through the semester. So those would be the ones to really talk to the Dean of Students, and then we're happy to consult. Does the school provide any mental health apps like Headspace? Yes, we offer You at American, and right now we have a TELUS app, which is my student support service, my student support program. It's all on our website. Wonderful psychoeducation materials to engage with to learn more about mental health. Let's see. All right. Someone has a verbal question that they want to ask. If you want to unmute yourself.
Yes.
Mm-hmm.
Yes. Hi. Thank you so much, Dr. Williams. I appreciate it. I'm a therapist myself. My son's going to be a freshman. And one of the things I'm concerned about for him, because he tends to be the kind of person who's really just a really good listener, and a lot of kids open up to him. I'm wondering how this lovely resource that you guys are offering, you said it quickly, I didn't actually write it down. There's some specific availability program that you have where you help students navigate challenges that roommates, friendships, right? Like if they find out that a friend might be doing something risky on social media, or maybe they're cutting, or maybe they're binge drinking. How do you guys make that known to the students throughout the year? Because it seems like something that, like, I'm just concerned about my son, but kids in general on campus sitting with heavy duty news that like their best friend is seriously depressed or thinking about hurting themselves. Like that's such a burden. And you're such a great resource. Like, how do you make that available and known throughout the year?
Absolutely. Wonderful question. And this will be, I think this might be the last question I'm able to answer. So the Question Persuade Refer program, they can always request a program, and we'll host them intermittently throughout the school year for all the students who are on the Engage app. And if they follow us on the Engage app, they will be alerted to different programs that we do. So they'll know if they follow us. Otherwise, they'll have to look us up every now and again to see what new programs we have going on. So follow us on Engage and follow us on Instagram. Students can always schedule a single session appointment with us if they want individual conversations about their unique concerns. And then say if they're part of an organization or in the residence hall and they want us to do a one-off program, we are absolutely happy to do that. If they're part of an organization, we're happy to go to that organization and talk with that. When there are large scale events that's impacting the community at large, we will often hold spaces for students, and we send that out on the Engage app, and we'll put it on our Instagram. All right, I'm so sorry that I've not gotten to all the questions. Feel free to email me. I am right at the top of the staff page on our website. I am happy to jump on a call. Now is a great time that it's in the summer because I'm not as busy, but I really appreciate you all taking the time to learn more about mental health at AU. I'm wishing you all the best in the rest of your New Eagle Essentials. So take care.
For session one, we're going to bring up a Zoom poll for you to select which room you would like to go into.